Adding to that pressure, 3 of every 5 long-term care homes in the province are experiencing outbreaks of the Omicron COVID variant. Here in Windsor-Essex, it's worse. Homes in outbreak at a slightly higher rate. Dale Molnar has been checking in with these homes, those on the front lines. He joins us now live. Dale, we just heard about the stress of this pandemic. What effect are the outbreaks having for staff and residents in these homes?
Well, Chris, the outbreaks of Omicron aren't as deadly as the outbreaks of COVID-19 before the vaccine. In fact, right now at Windsor Regional Hospital, only 5 residents from long-term care homes have been admitted to hospital with Omicron, and none are in the ICU. People are telling me now the protocols that have to go in place are doing more harm than good. Heron Terrace Nursing Home in Windsor has an outbreak among 3 residents and 12 staff. The CEO of the company that owns it says outbreaks of Omicron aren't resulting in the deaths COVID-19 did before residents were vaccinated. He says it's now the outbreak protocols that are taking the heaviest tolls on the residents. Many have to isolate in their rooms so they don't get physical and mental stimulation, they don't see other residents, and they don't get baths.
Certainly it's hard on staff that are experiencing COVID themselves, their families, close contacts. It does add that level of stress, and it certainly creates issues with staffing and bringing in additional staff working overtime, bringing in agency to cover shifts. But our residents, when they do end up in isolation, it's been like a roller coaster.
The head of an organization that organizes peer support groups in nursing homes says they have written the Ministry of Long-Term Care to see if the government can strike a better balance between safety and flexibility.
Exploring tweaking how outbreaks are handled so that folks within a neighborhood or a unit, if all residents test negative, that they have some more freedom and flexibility. For those folks who can make a decision or be helped to make a decision about things such as, leaving the long-term care home and going to Tim Hortons to grab a cup of coffee. They should be able to do that.
Scotland agrees.
Residents typically have 3 doses and are receiving 4th where they're eligible. It would be nice if we could find within those parameters and additional protection that's been afforded everyone, the ability to relax some of those rules.
Cardinal Place Retirement Home has not had an outbreak. The owner credits teamwork with everyone cooperating to make sure the disease doesn't come into the home.
Whether that be paying for our own PSWs to come in and do the government's work, providing all of the right gear that we can, keeping the space, making sure people are healthy at the door with a screening and rapid tests, doing all the right thing. But most importantly, it's been everybody's mindset, from staff to the members, the elders living here and their families, all taken the #1 priority is protecting our elders.
Now, Mike Cardinal there is concerned that HEPA filters the province promised a month ago haven't arrived. In the meantime, they are making sure that there's lots of fresh air being pumped into the building. They're keeping people spaced and wearing masks. Chris?
Thanks, Dale. CBC's Dale Molnar live tonight.